Have you ever felt like the world is spinning around you, even when you're perfectly still, or experienced sudden, intense vertigo accompanied by nausea and imbalance? You might be experiencing symptoms of vestibular neuritis. In this video, we'll explore this inner ear disorder that can disrupt your sense of balance and spatial orientation. So, what causes this disorienting condition? Vestibular neuritis is believed to be primarily caused by a viral infection. Viruses like herpes simplex, the same virus that causes cold sores, are often implicated. The infection inflames the vestibular nerve, which is responsible for transmitting balance information from the inner ear to the brain. While viral infections are the leading suspect, in some cases, the exact cause remains unknown. Factors like autoimmune disorders might also play a role in the development of vestibular neuritis. To understand vestibular neuritis, let's delve into its pathophysiology. The vestibular nerve, as mentioned, has two branches, the superior and inferior vestibular nerves. These nerves send signals about head position and movement to the brain, allowing us to maintain balance. When a viral infection attacks this nerve, it causes inflammation and damage. This disrupts the normal flow of balance signals. The brain then receives conflicting information from each ear, one side functioning properly and the other sending distorted signals. This mismatch is what leads to the characteristic symptoms of vertigo and imbalance. Vestibular neuritis affects people of all ages, but it's most commonly seen in adults between the ages of 30 and 60. While exact figures are challenging to obtain, it's estimated that vestibular neuritis accounts for a significant percentage of cases of peripheral vertigo, which is vertigo caused by inner ear problems. It's important to note that vestibular neuritis is not contagious. The hallmark symptom of vestibular neuritis is sudden, severe vertigo, often described as a spinning sensation. This vertigo can be so intense that it causes nausea and vomiting. Other common symptoms include imbalance, difficulty walking straight, nystagmus, involuntary, rapid eye movements, and blurred vision. Unlike some other vestibular disorders, vestibular neuritis typically does not cause hearing loss or tinnitus, ringing in the ears. Diagnosing vestibular neuritis usually involves a thorough medical history, a physical examination, and specific tests to assess balance and eye movements. The doctor will likely perform tests like the Dix-Hallpike maneuver to rule out other causes of vertigo, such as benign paroxysmal positional vertigo (BPV). Further tests may include electronystagmography (ENG) or videonystagmography of (VNG) to measure eye movements, and vestibular-evoked myogenic potentials, a VMPs, to assess the function of the vestibular nerve. MRI scans are sometimes performed to rule out other conditions, such as strokes or tumors, that can cause similar symptoms. While vestibular neuritis doesn't have distinct classifications, it's important to differentiate it from labyrinthitis. Labyrinthitis is a similar condition that also involves inflammation of the inner ear, but affects both the vestibular nerve and the cochlea, which is responsible for hearing. Therefore, labyrinthitis presents with vertigo and hearing loss, while vestibular neuritis primarily affects balance. The primary goal of treatment for vestibular neuritis is to alleviate symptoms and promote recovery. In the acute phase, medications like antihistamines and antiemetics can help reduce nausea and vomiting and suppress vertigo. Corticosteroids are sometimes prescribed to reduce inflammation of the vestibular nerve. However, the most effective long-term treatment is vestibular rehabilitation therapy. This involves specific exercises designed to retrain the brain to compensate for the damaged vestibular nerve and improve balance. These exercises might include gaze stabilization exercises, balance training, and habituation exercises. Over time, the brain learns to rely more on other sensory inputs, such as vision and proprioception, awareness of body position, to maintain balance. Unfortunately, there isn't a guaranteed way to prevent vestibular neuritis, primarily because viral infections are often the culprit. However, maintaining a healthy immune system through proper nutrition, regular exercise, and adequate sleep may reduce the risk of contracting the viruses that can trigger the condition. Managing stress is also important, as stress can weaken the immune system. The prognosis for vestibular neuritis is generally good. Most people experience significant improvement in their symptoms within a few weeks to a few months. Vestibular rehabilitation therapy plays a vital role in accelerating recovery and minimizing long-term balance problems. While some individuals may experience lingering dizziness or imbalance, particularly in challenging situations like walking in the dark or on uneven surfaces, most can return to their normal activities. Recent research is focusing on developing more targeted antiviral therapies and exploring the potential of neuroprotective agents to minimize nerve damage and promote faster recovery after vestibular neuritis.